what exactly is hip dysplasia, Dr. Suarez?
So hip dysplasia is the medical term for when the hip does not develop as normal. And usually what happens is the socket side or the acetabular side is a lot more shallow than it's supposed to be. It's supposed to be a ball in a socket, and when the acetabular or the socket side is a lot shallower, then it predisposes the hip to get abnormal forces, which develops arthritis early on in life.
Now, with hip dysplasia, that's something that you're often born with?
Yeah, it's genetic predisposition is big, and people are usually born with that condition.
Wow.
There's extremes to it. There's different levels of hip dysplasia, either from 1 to 4, but it's definitely, you're born with it.
So with that being said, is surgery an option, let's say, if you're a child and you have hip dysplasia, or is that something that develops over time and more often treated as an adult?
Well, one of the, when kids are born in the United States, one of the things that they do, they test the hips of the newborn for risk for hip dysplasia. And some kids are identified early, and they get harnesses to they put harnesses, and sometimes they even have surgeries when they're a kid to try to prevent the consequences of hip dysplasia later on. But even then, they can still develop the arthritis later on.
So how does that affect growth then, if you have hip dysplasia?
Well, it depends. I mean, sometimes if you have mild dysplasia, it's not a big issue. But if you have severe dysplasia, the heads of the hips are out of the socket completely,
right.
And you really don't have a normal ball and socket. It's completely out of the socket and we see patients that have been neglected for years, and they've been walking with their hips completely out of their socket for many, many years.